Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. What started as all things related to brain health and wellness has morphed into largely brain injury health and wellness, with occasional other neurological topics. My mission remains the same, to help you on the path to a healthier brain. So, without further ado, let's get into the show. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Maureen Cunningham. Maureen has been with the Brain Injury Association of Missouri as executive director since 2008. She has more than 30 years of experience in health, social, and disability nonprofit organizations, and I'm super excited to get another state checked off the list here on my little goal to get all the states covered in the United States. So thank you so much for being here today, Maureen.
Thank you for this opportunity.
Of course. So my first question to my guests is always just kind of what got you to where you are today? What got you into being the executive director at the Brain Injury Association?
I've always been in nonprofits, and I started as a volunteer director, an office administrator, development, and finally in about 2008, it's like, okay, it's time to put it all together because that's what's needed for volunteer or for nonprofit leadership is all those components coming together. So when the opportunity at the Brain Injury Association of Missouri opened up, I said, okay, this is it. And I laughed because as my career was developing, I thought, I'll be here 5 years. It got to be 8 years, and it's like, I can't imagine being anywhere else. And that's still how I feel today. It is such an honor to serve and work with individuals with brain injury and their families.
Do you have any personal connection? A lot of time people that get into these roles have either a personal or a family or close friend connection.
Not a diagnosed traumatic brain injury or even a stroke or anoxic brain injury. Knowing the symptoms, there's probably some undiagnosed from childhood or teenage years that, because, several of us have had a concussion. So we've had a brain injury because a concussion is a traumatic brain injury, but not one that has impacted daily life to the point of physical or cognitive or emotional assistance every day.
Well, that's good. That's never something I wish on anyone, but I do think that if you've had that kind of personal connection, it tends to just make you a little bit more passionate about what you do. Not that people that don't have experience can't have the passion too, but it's just a different kind of passions. I'm glad you're there. So thanks for being there. What kind of services do you guys offer in Missouri?
So similar to a lot of the brain injury associations, education, recreation, and legislative advocacy. When I always describe us to people that aren't familiar with the Brain Injury Association as the emotional and social side of brain injury. So from the stuff that falls through the cracks, from hospital to rehabilitation, if you do get any, to community integration and living a quality life with brain injury. So our supports, we have support groups. We have support groups that meet across the state. Right now, I think we're up to about 20. Some meet in person. Others meet virtually so that somebody if transportation is a barrier, either getting there or distance, or for rural communities, transportation can be an issue. So there's always the virtual option for a couple of our support groups. We have 3 that are virtual specifically. The other support, one of our primary services is resource facilitation. What we call is community resource service. So we connect individuals with brain injury based on their needs, what is available in their community. Our program associate will work with the individual, find out what is going on at this point, and start on resources for immediate needs. With our community resource services, we also have follow-ups where we'll follow up at 3 months, at 3 weeks, 3 months, 6 months, and a year, because as one need is met, another one surfaces. And we want to make sure that survivors and families know that they're not alone at any point of the journey. And so as one need is met, we'll connect them with other resources and to find out Did they get connected with the first resource or two that was suggested? How is it going? If they didn't get connected, find out why and see if there's another option that may be better. And we always encourage attending the support group. That if at first it's like, I'm not going to go to a support group that's not me, it's like, it really should be. So we encourage the support groups. You
Yeah.
know,
Yeah.
one thing that is unique about Missouri and our support programs is that through a partnership with Missouri Agribility, we have a brain injury resource kit that includes our brochure on brain injury recovery, step by step brochure that looks at functioning level at the general stages of brain injury recovery and questions that the person may need to ask themselves and others based on functioning level. And it also includes our partner, Missouri Department of Health and Senior Services, with looking at those options based on the functioning of the person. We also include the Missouri Living with Brain Injury Green Book that gives a good overview of Brain Injury Association of America Caregiver's Guide, because brain injury does not affect just the person injured. It also affects the daily life of family members. And then we have a journal for hope that, at the time of injury and recovery, we encourage people to journal, to write down questions that they have for the doctor, to write down either pictures or in word what the person is going through, what they're feeling, to help process it. And then, to also be able to reflect later that that step didn't feel important now, but looking back, that one step that I was able to take, that one word I was able to get out, that one accolade that I was able to say, thanks, Mom, that was a big deal. And to have it written in a journal is so comforting and so helpful for the individual and families.
Yeah, I've spoken to a lot of people that have had brain injuries that really were glad that they did journal because they were able to identify things. I didn't journal per se in my own recovery, but I kept a spreadsheet. So I kept track of where my symptoms were and what was happening. And I became so grateful for that later because there's a lot that you don't remember and you don't realize you don't remember it as you're going through that recovery process. So that journaling is really important. I love that you guys highlight that. And I also
Yeah.
really liked when you talked about kind of the things that show up later, because I call it the peeling back the layers of an onion. As you kind of take things away, you address things, other needs come to the surface. I've had colleagues of mine that have said, patients have come in months later and said that they have these issues. It can't really pop up then, does it? Like, well, it can pop up to the surface at that point. Yeah, absolutely. And I think a lot of people don't recognize that.
Absolutely. Well, it's because what's most important at that time is what's
Mhm.
going to show up at that time.
Yeah.
And it makes sense no matter if there's a brain injury or not.
Yeah. Yeah, absolutely. You mentioned some of the other populations in there too. Do you guys cover all acquired brain injuries or is it mostly traumatic?
We're all acquired brain injuries.
Okay.
So, traumatic brain injury, along with stroke, anoxic brain injury, and tumors. If it's a disease, such as Alzheimer's or autism, we do refer those individuals to those organizations that are better equipped for them. But again, MS, we don't turn somebody away. If
Mhm.
a support group for somebody, with MS, which is a brain injury, but it's like this one really works best for me. It's like, absolutely. And all of our support groups, I mean, there's one that's only survivors of brain injury, but most of our support groups are for individuals with brain injury as well as their family members.
Yeah, because as you mentioned, it is the entire family that gets affected. It's not just the person that has the injury. So it's great that you guys have that too. One thing that Minnesota is starting to do or trying to start is a support group for kids of adults that have brain injury. Do you guys have anything like that as part of your support groups?
Not specifically. We do have a couple of our unique population groups is we have a males support group, so males with brain injury. And then we are also looking at starting a partnership group for parents of kids with brain injury, that they also have unique challenges, especially if they're siblings. But when a brain injury happens to a young child, it's very hard to know the whole future is going to be changed. But again, when your child has a brain injury, traumatic or a stroke, anoxic, that it's still very traumatic and very challenging. Of the future's going to be different, but that's why the Brain Injury Association Missouri is here to say it's going to be okay. It's going to
Mhm.
be different, but let's get you connected to resources and other survivors that can provide that help and that hope to say, this is what we went through, this is what we tried, this is what worked, this isn't what worked for us, but try it.
Do you have any kind of metrics or information on the benefit and the impact of the programs that you offer?
We do. I don't have the date off the top of my head, but we do know that about 75% of the calls that we get are traumatic brain injury through our community resource services. Most of the individuals that attend our support programs, as well as our educational programs and our recreational programs, are adults with brain injury. So, the standards kind of
Mhm,
across the nation that,
mhm,
we do get the notes from individuals that attending a support group or attending our survivor and family seminar, which is one of our educational programs, was profoundly important to them. We've had people that it's like, knew something was going on after a car crash, but nobody told me at the hospital. They never even looked at, I have had a brain injury, but I knew something was wrong. So then when they would come to the survivor and family seminar, they would hear and go, that's what I have. And then they knew, okay, let me go and get a diagnosis so we can get on the right treatment, the right recovery plan, and the right adjustment plan.
yeah, yeah, and then, do you guys have waiver services? That's one thing that I've identified as I've been interviewing people from the different states, is that some states have waiver services and some do not. Where do you guys sit in Missouri with that?
So the brain injury, so Missouri has a brain injury waiver. It just started actually about 5 years ago, which is, it seems shorter than that, but it's a very small program with only 40 slots. And it is for individuals, adults age 21 to 64 with a traumatic brain injury by definition. So it is through our Department of Health and Senior Services, not the Brain Injury Association of Missouri, but we do promote it through our educational programs to make sure, again, that we're getting people connected to services if
Mhm.
they qualify for the brain injury waiver.
Yeah, yeah. It's been interesting to find out the states that don't have it, how much of an impact it can make. I think it was Arizona that I talked with a couple of months ago, and they actually had a patient who was thinking about moving and ended up not because they weren't able then to continue the services that they needed. It's remarkable how much of a difference that can make in someone's life.
It is definitely something that people need to consider if they are looking at moving. That
Mhm.
what services are currently available within the current state, and what is there a waiting period when they move to a new state and so forth.
Hmm.
With our survivor and family seminar within our education programs, we just finished our seminars. It's a statewide program, and we have the same sessions at 3 locations. And one of the sessions this year was on benefits, including the waivers, and highlighted the brain injury waiver, and also highlighted the adult brain injury program, and then services through Department of Mental Health for developmental disabilities.
Very cool.
Yeah. Yeah.
Yeah.
And I have to say, our survivor and family seminar is one of my favorite programs that we offer, because our professional development conference that will be in October is really to help professionals renew or be refreshed or learn best practices in caring for individuals with brain injury. So they want the statistics, they want the evidence-based research. Survivors and families, with the seminar, we focus on practical suggestions of what can I do today to make life better tomorrow. They want to know that there's research, they want to know that there's hope out there, but just tell me what to do. How do I manage this behavior? How do I work on positive relationships? What questions should I be asking, my doctors, or how do I help family members understand brain injury? So it's really those practical suggestions of how to.
Yeah, yeah. And that's what people need. Yes, they want to know that it is evidence-based practice, but they just want to know what's going to help them the most. How can they access that information? So
Absolutely.
that's perfect. That's perfect. And I was going to ask you what your favorite service was, and you already answered that one. What's one thing that you wish that you could do within the organization that maybe you haven't been able to yet?
Help everybody that when they call for resources, there's gaps in services to get all of those gaps in services filled, such as with Missouri developmental disabilities. If somebody has to be, the traumatic brain injury has to be under age 22 or 21 and younger. And so somebody on their 22nd birthday, that if they have a traumatic brain injury or even a stroke, services are very limited, including residential services. And, there are a lot of survivors of brain injury, 26, 36, 46, that loved ones cannot stay home from work. They may have to quit their job, but the individual needs 24-hour supervision or 20-hour supervision. They can function, but not to the point of, are they going to leave the stove on? And so that's where residential services, along with day programs, help the individual with brain injury thrive and provide comfort for the family that my loved one's going to be okay. I can still work and know that my loved one is going to be okay and thriving with other survivors. But Missouri does not have residential programs for high functioning, mid functioning individuals with brain injury. It's either a nursing home, and many nursing homes, will not accept anybody under 55, no matter what the criteria, and or assisted living, which also often is not covered by many programs. So families have to choose, take the chance or quit work and hope I can pay my bills.
Yeah, and that's not a great decision to have to make.
No.
What are a couple of things that you wish more people knew about brain injury?
I wish that more people recognize that they probably know somebody with brain injury. That, when I speak to groups, or when volunteers of our Speakers Bureau speak to groups, but especially, our 4-H Save Your Brain program for kids, within the schools, elementary, middle school, even high school, but talking about these are the causes, these are the symptoms, and but it's like, okay, who knows somebody with brain injury? And really all ages. Some of the people will raise their hand after we talk about the symptoms and some of the behaviors and changes that they may have recognized. It's like, okay, now who's thinking you may know somebody with brain injury? So that's one thing that I would like, is that people recognize, there's a lot of survivors of brain injury.
Mhm.
And you probably know somebody with brain injury. You maybe not have known them before the injury, or there may be subtle changes that you're just not quite sure what the difference is. And then it's like, oh, yes, remember that fall, down the steps 4 years ago? That kind of changed it. The other thing that I wish people would recognize and is to, in the hospital, that if a loved one, especially a senior, has had a fall and, it's like, oh, they have a broken hip, to really start to look at, pay attention to changes in behavior and ask the doctor. Did you do a cognitive test? Could they have a brain injury? That always ask, that they're screening at every level within the hospital of, Could the person have sustained a brain injury? What should I be looking for? The other thing in Missouri, that if a brain injury is suspected, it would just be wonderful if medical professional would write that in the medical records. Not just say to the family, you might want to look at this, that to put in the medical records, the person may have sustained a brain injury, watch for symptoms. Because for our Department of Health and Senior Services adult brain injury program, and with most government programs, medical documentation is needed. And if it's in the medical records, it makes it so much easier for the individual to get through the bureaucracy and get to services.
Yeah. Yeah. I think that's not just a Missouri thing, unfortunately. Even here in Minnesota, as I've seen patients getting discharged from the emergency department or even the hospital, and they come see me in follow up, concussion or head injury might not have been listed on the diagnosis list from the hospital. And I've had patients that have fallen, they've had head bleeds, and concussion brain injury still was not on the list. Working in neurology before I came to just all concussion, we would get consults occasionally on patients that had fallen, they had a head bleed, and they had neurological symptoms. So we were getting consulted because why did they have neurological symptoms? And my answer was always, well, if they hit their head hard enough to have a bleed, they had a concussion as well. So that explains a lot of that. And it's interesting that healthcare providers don't always catch on to those things. And the fact that you don't have to hit your head. So that grandma with her broken hip, she may have had a head injury because you don't have to hit your head. It's that whiplash activity that can happen in the brain that causes the damage too.
Absolutely.
Yeah. So definitely not just a Missouri thing on that one. If you had your way, what would you like to see in the future for brain injury?
That there is always a screening, and that at every level, even with pediatrician offices, that ask, have they fallen recently? Has anything changed in their development? But there is more screening. But my thing always is, okay, if the screening comes back, yes, are they getting connected with services? That is there that soft handoff. In Missouri, we are implementing a hospital to community program in partnership again with Missouri Agribility and our Department of Health and Senior Services, working with rehab hospitals, that when somebody with a brain injury is admitted or discharged, whichever works best for their system, they are provided the brain injury resource kit that I talked about earlier. And then there is that soft handoff of a connection form so that the family knows that we will be following up. And, most of the rehab hospitals request 3 months, that after they've been out of the rehab hospital for 3 months, to follow up and say, hey, Joe, how is it going? Have you attended a support group? What symptoms are you having? Are there needs that you have now? And, is it check back with your doctor at the rehab hospital, or is it life? I was supposed to be better. Usually it's, the 2 years that life was supposed to be better and it wasn't. I didn't expect this. That's where we're trying to get the connection to services earlier. So individuals don't have to hit rock bottom and call crying saying, this wasn't supposed to be happening to me. I was supposed to be better. That's what we want to take care of, is that get connected to services, know you're not alone. And, and we do make a difference every day for survivors and families through all of our programs for the survivors, families, professionals, as well as communities.
Yeah, that's a fantastic goal. Absolutely. A question on that resource packet. Who gives that to the patients?
It really depends within the hospital system, the rehab hospital system. Usually it's a therapist. Some are looking at a discharge planner, but usually it's a therapist that's working with them to go over the Missouri Green Book with them, go over the Missouri Agribility Journal for Hope of the importance of journaling. and sharing the step-by-step recovery brochure with them to say, here we are at the beginning. These are some of the stages that, you're going to be looking at, and it's based on functioning level. Our step-by-step recovery brochure does not talk about payer at all, because that's always a very frustrating issue of it. Let's not worry about who's paying. Let's look at the functioning and what can be done. And then that's when our community resource services comes of. Let's look at services that may be available.
I only ask kind of where that comes from because in Minnesota they've educated a lot of the hospitals about our booklet that we have from the Minnesota Brain Injury Alliance. Ours is an alliance, not an association, but they have this phenomenal booklet that's full of information and they give it to all the facilities. But I even went to one of those facilities that was supposedly trained and I was never educated on it. So it's kind of that making sure that the facilities are doing what they're supposed to do. Do you feel like you get back the number of patients that you anticipate getting?
It is definitely still a work in progress.
Mhm.
That some of the sites, give out the resource kits and others do make that direct connection. So it still is a work in progress and so that we are looking at data to say, and we're just starting, but when they get connected, that they're connected longer. And
Good. Can people self-refer also into that program for you guys?
so the hospital to community, the brain injury resource kit, we would likely send them the green book only,
Okay.
which has the overview of brain injury, just so that we know it's really getting used as needed. We do, hand them out for free for now because it is through a grant funding.
Mhm.
So with the focus of the rehab hospitals discharging to rural and urban communities.
And what about the emergency room patients?
We have our step-by-step recovery brochure, but we have not had a lot of interaction with the emergency rooms. We're focusing more on the rehab hospitals because even at the ICU, there's still so much unknown
Mhm.
that it in the emergency room they might go home, but we are trying to get the resource or the brain injury step-by-step brochures in the emergency rooms. The ICU, we've had survivors and families tell us really families mainly of just wasn't sure what tomorrow or the next hour
Yeah.
was going to bring. To tell me that 6 months down the road or even 6 days down the road, this resource is going to be available. It's like, I just want to know, is my son or daughter going to be here tomorrow? And so that's why we focus on the rehab hospital.
That makes sense. That makes sense. Yeah, I think with the emergency rooms, I wish that I could get in and talk to providers a little bit more because there's always kind of that lack of knowledge. Did they actually have a head injury? Did they not? And if they don't have symptoms right away, what can you do about it? How do they identify it? And so many of those patients end up coming back a second time. And that's, I think, where we're getting the whatever brochures you have would be a great thing for them, especially if they're coming back and now they have these new developed symptoms. Yeah, I have more thoughts in my head than I have energy to do most days.
Exactly.
Where can people find your organization if they want to learn more about the services that you provide and everything like that?
Okay. So, through the Brain Injury Association of America website, and then we also, then you just choose Missouri. But our email, our website is biamo.org. And then the phone number is, and when the computer voice says, what state are you looking for resources, you say Missouri. And if you hold on, if it doesn't, they'll just direct you to Missouri. Yeah.
I will include that information in the show notes so people can find that information a little bit easier, as well as the social medias so they can find you that way. Any last words of wisdom you'd like to share with our listeners as we wrap up today?
Not really words of wisdom. Well, the words of wisdom would be that just know that there is help and hope available that is
Mhm.
going to lead to healing. And the one thing that I do want to mention is that in Missouri, we have our Bowling for Brain Injury event coming up in June that it's our only fundraising event hosted by the Brain Injury Association of Missouri, and it supports all of our programs. So anybody in Missouri, we would welcome you to participate. And even national, we do have a Spare the Alley, Join the Rally option so that you could fundraise without bowling in person at one of the 3 events in June.
That's awesome. Thank you so much for being here today, Maureen, and sharing the information about your state's organization. I love getting the word out there about all of these things. So thank you so much.
Great. Thank you. Bye-bye.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, leave a comment, and share it so that others can benefit. Please also consider supporting the show by buying me a coffee. The link is in the show notes. You can also go to www.brainwellnesssolutions.com to catch the latest info and get links on all of the social medias there. See you next time.